previously we had several other engagements with the county through the executive and the Department of Health to try to engage them on some of the issues that were pertinent to the issues affecting the doctors of Garissa. So we raised with them at one point, somewhere in 2020, we went for a strike. That was a local strike. We had a return to work formula agreement with them that was signed by them, the county secretary, the CEO, public service board, the county secretary, the chief officer health, and the county union officials. And that strike was not only specifically for doctors, so it had the nurses were part of it, the clinical officers, it was just general lab, and then the lab technicians were part of it. So it was a general strike that was affecting across all cadres. That was in 2020. We signed the return to work agreement, and some of the issues we raised then are some of the issues we are raising now. So that's 4 years down the line. There was dishonesty, there was lack of commitment, there was lack of goodwill from their end to try to sort out the issues we were raising. And some of these issues are spanning for over close to 10 years now, because we raised with them some of the issues that we raised in the current strike were mainly 4 or 5 issues. And when you look at the return to work formula of the 2020, it still captures those issues we raised in 2020 and still what is recurring now. And some of the issues we raised was the issues of promotions and redesignations. If you look categorically, the doctors in Garissa County were not officially promoted since 2015. So which means someone who was recruited in 2015 has stagnated in the same position. And that is against law, that's against the spirit, that's against everything. Because there is a scheme of service that guides the doctors. There is a scheme of service of employment of doctors. That scheme of service clearly outlines how this doctor or how this officer is supposed to progress. Because when you talk about promotion, those are some of the things that give motivation to the staff. It gives them the hope that I'm progressing somewhere career-wise, work-wise, remuneration-wise. Those are some of the benefits. So if you look at the county government, that thing has not happened since 2015. Whatever promotion that happened was maybe someone knows someone and they get a promotion. Those are back those things. But officially, since 2015, there was no promotion. And when it comes to the designation, now these are officers who are working in certain job group, went back to class, came back with masters, and now are serving as specialists. So since we had those previous engagements with the county government and some of those things were not honored, once this strike started, then we gave them demands also. Among this, within this strike, there are specific issues, and the strike notice of dated 17th of March is what we forwarded to them, and that's on point number 2 that says current strike that is ongoing and the issue raised therein. So there are about 6 issues we raised with them. Issue of promotions and resignation came back. Issues of postgraduate training came back. Issues of comprehensive medical cover. If you look at our staff, Garissa doctors, majority of them don't have a comprehensive medical cover, so majority of them cannot afford the service they offer themselves. So you have a specialist who cannot offer the service he offers because he doesn't have a cover provided by the county. For majority of them, the few who have cover are those who came with national government who have an NHIF comprehensive cover that's already on its way out, being phased out. Then, so we had those issues we raised with them. Now, in response and in fairness to the county, they called us for a meeting. Despite us having agreements with them that they have not honored before, we honored the invitation and we went for the meeting. Now, did we meet the right people we were supposed to meet? No. We met the head of department. Now, when you look at the CBA, the people whom we were supposed to negotiate,
please name them the department that you have met.
So, but one thing is that when you call me for a disciplinary meeting, that disciplinary committee must have someone senior or someone at my level. When you sit, it happened to me that in 2015 I was called for a disciplinary meeting because of strike issues. And the people who were seated for the disciplinary committee were the then CEO, who was a nurse by profession, the nursing officer in charge of the hospital, the HR, and the administrator. So when I sat there, I asked them, why was I called? And they said, it's a disciplinary committee. I stood up and told them, please reconstitute the committee. And I left. The letter they wrote to me, I wrote it to the council. So the council wrote to them and they were told, please have someone else. At least if you don't have someone in the meeting, call up someone in that meeting. And on that note, that time I was a medical officer. I wasn't a consultant. Now you call for a consultant at the disciplinary committee. Consultant sits there. He wants to talk. You want to talk to him. Where he went wrong, you don't know. If Dr. Ali has gone through something or the pediatrician has messed up a patient, and it is true that maybe they have messed up a patient, it is upon the chair of that committee or a senior member of that committee to say, these are what is required, these are the common mistakes that are common, that happen, but this is negligence. For you to say that, you must have authority in your field and in that field of that person. I cannot just walk and dictate to Dr. Ali in terms of EAD because he's an authority in his field. That's why he's called consultant. He's consulted in that area. And so someone who's junior cannot tell him, you're supposed to do this. I hope you understand.
Yes, I get it.
Yes, please. Thank you.
Thank you very much.
Need a cab? Order Faras. Get 10% cashback in form of Faras miles. Convert your miles to airtime, data, or M-Pesa. Faras. Safe, affordable, convenient.